From the American Academy of Pediatrics.
Autism is a complex neurodevelopmental condition with diverse presentations and no single known cause. That's why any potential treatment must be carefully evaluated.
The AAP has new interim guidance about the use of Leucovorin for autistic pediatric patients.
Neuroaffirming care is really important. And that's probably what I do with my patients on a daily basis, is help their families and the world around them accept these children for who they are.
Plus, we'll commemorate 25 years of PediaLink.
As a resource, it's there to help us improve kids' lives. And that's really what the AAP is all about.
These stories and more on Pediatrics on Call, the podcast on children's health from the AAP. I'm Dr. David Hill.
And I'm Dr. Joanna Parga-Belinkie. This podcast is for everyone in the medical community, keeping our children healthy and safe.
It's a show by pediatricians for pediatricians.
But anyone who cares about kids will get a lot out of it as well.
Let's start today's episode with a look at new interim guidance on Leucovorin.
Autism is a condition that lends itself to medical myths and rumors. It is likely a multifactorial condition. It occurs on a spectrum, and the behavioral challenges can be so great for some families. They are desperate to find a way to treat it.
I agree, Joanna. When you have so many families so passionate to help their children, any information that appears to offer hope is bound to draw attention, regardless of the quality. Pediatricians know how hard it can be to help children with severe autism, but also how joyful it is to watch children with autism grow and express themselves in ways that are unique and different.
There is a real beauty to neurodiversity, which makes questions about how to support these patients very complex and nuanced. Headlines would suggest Leucovorin is a tool families can use, but we know headlines are flashy and science is more subdued.
We need to talk about this, though, because so many general pediatricians are getting asked about this supplement. And the AAP just published interim guidance to help address these questions. Today, we have one of the authors of that guidance, Dr. Alice Kuo, to talk about autism, Leucovorin, and getting good information to families.
Dr. Kuo is a professor of internal medicine and pediatrics at the David Geffen School of Medicine at the University of California, Los Angeles. As an MD-PhD, her research is focused on delivery of developmental services to children, cognitive and language development, and neurodevelopmental disabilities. She is the current chair of the Autism Subcommittee on the Council on Children with Disabilities. Alice, welcome to the show.
Thanks so much for having me. I'm happy to be here.
I wish we had time on the podcast to discuss in depth the factors that may contribute to autism. As an expert in neurodevelopmental issues, how do you think about those factors?
So I think that what we know right now from the research is that autism is largely a multifactorial condition. So there are likely some genetic factors that can contribute to whether a person will be autistic. And those factors are probably also mediated with some environmental factors. So I think it's pretty complicated. And in the end, to me, autism is a brain type. Just like, there are a lot of different types of brains out there. Autism is one of them.
And when pediatricians are looking to support families with autism, what have you typically recommended for your patients?
Yeah, so my primary care practice is primarily both kids and adults with neurodevelopmental condition. And they need the same things that everybody else needs. So, providing good, well childcare, anticipatory guidance, supporting parents in management of common behavioral issues. And so it's not much more difficult than non-autistic child, for example. I think listening to where parents are, making sure that their supports are optimized, that they're accessing all the resources and programs that their child may be eligible for, getting support through the schools for learning differences, I think are all ways that pediatricians can support autistic children in their practice.
I think most pediatricians know leucovorin as folinic acid, also known as vitamin B9. And there's some misleading information out there, but there's also some underlying truth substantiating the claims. How did folinic acid become a focus as a supportive therapy for autism?
So, my understanding in reviewing many of the studies myself is that in around 2000, 2002, there was a new condition that was identified called cerebral folate deficiency. And it was described in maybe a couple dozen patients. And this deficiency was characterized by pretty significant neurodevelopmental delays, as well as seizures and some motor findings as well. And so over the last 20, 25 years, this condition has been known, but it's extremely rare. And so when there was the identification of metabolic differences leading to an actual deficiency of folate levels in the CSF, right, in the brain, so to speak, then the ability to supplement that deficiency with something like folinic acid became explored. But these studies have been in very small sample sizes with selective patients. And so, in order for us to know how effective and which patient populations something like folinic acid would be appropriate in, we really do need larger, more rigorous clinical trials, which hasn't happened yet. I think it's also important to note that folinic acid, it shouldn't really be considered a vitamin or a supplement. It is a biologically active form of folic acid, which is a supplement or a vitamin. But this biologically active form does require prescription. And one of the biggest distinctions from folic acid is that folinic acid can cross the blood-brain barrier. So it will cause side effects because there are other things that are affected when folinic acid is present in a child's system.
So I just want to be really clear from what you just said, because it sounds like if somebody ran out to the drugstore and bought an over-the-counter folate supplement, that would not have the same effect. Is that right?
Correct. So folic acid is what you could buy in any supermarket pharmacy. And folic acid is a vitamin that is important. And, pregnant women are encouraged to make sure that their folic acid levels are high. It's included in prenatal vitamins. And if a pregnant woman has had a previous child with any neural tube defect, they're actually recommended to be on higher levels of folic acid. But we're not talking about crossing the blood-brain barrier in a person who takes folic acid. In cerebral folate deficiency, there are either genetic differences or enzyme deficiencies that lead to lower levels of folate in the brain. And so you need a biologically active form of folate to be able to cross the blood-brain barrier and address that deficiency. And so that is folinic acid. And folinic acid is not available over the counter. It does require a prescription. And the most common use of folinic acid at this time is in patients receiving chemotherapies that do cause a folate deficiency. So it's used as an adjuvant in many oncology treatments.
And cerebral folate deficiency, you mentioned, is just a very rare condition. How and when would a pediatrician test for it, and can they trust the test?
Oh, yes. So this is an emerging field, I would say. So my understanding, because I've never actually had to diagnose cerebral folate deficiency, is that the general way that this is identified is in an infant or toddler who perhaps has seizures of unknown etiology. So, it's in the workup that pediatric neurologists will do if they can't figure out why a child has seizures, if there is a regression of developmental milestones. But I would say the presentation of children who may be considered for cerebral folate deficiency seem to be more significant, right? Maybe more developmental challenges, global developmental delay, intellectual disability, seizures, ataxia. So it's a large constellation of symptoms that manifest when a child actually has cerebral folate deficiency.
And so not something that a general pediatrician would typically explore in the office?
I don't think so. In my experience, I've taken care of probably a couple of thousand of autistic people by now. It's never entered my mind. The AAP did release guidelines over the summer, just a month or two ago, about the importance of genetic testing in autistic people, autistic children. And so that's also another way to screen because there are known genetic mutations that lead to cerebral folate deficiency, but it's never come to, the forefront of my differential diagnosis, for example, when I'm seeing a child with a developmental challenge.
So, Dr. Kuo, I have to tell you, my wife is in pediatric mental health, and a lot of her parents of patients with autism are asking her to test them or treat them. If she wanted to, how would she go about this testing?
Yeah, so I would say as a general pediatrician, we would not normally be the one to test for this. It would probably be a specialist like a neurologist or a geneticist. But in some areas of the country, I am aware that, there are pediatricians for whom specialists are really far away or difficult to access. So technically, the diagnosis of cerebral folate deficiency is made when the blood folate level is normal, but the level of folate in the CSF is low. So one of the problems, I think, is that you would have to obtain a CSF sample, which requires an invasive lumbar puncture. So this index of suspicion would have to be pretty high in order to subject a child to that. And so it's not necessarily a test that I would enter into casually. There are also the antibodies that are, so these folate receptor alpha autoantibodies, FRAAs, are one of the reasons that the folate level might be low in the brain. And so, there is a test available. It's not commercially available. My understanding is that it has not yet been FDA approved, but there is a small company that will do a test for folate receptor alpha autoantibodies. I would say that my concern for it is that it might not be covered by insurance. So that would be a huge factor in being able to access that test. And it also is not definitive for cerebral folate deficiency. So to make the diagnosis, it's CSF and genetic testing.
And I think you're going to hear some people say, well, folinic acid, what's the harm in trying it if it might help? But you mentioned earlier that there can be some side effects. Would you tell me a little bit more about those?
Yeah, so again, in the studies that have been conducted, they've been in small sample sizes, and they did a good job of trying to document the range of side effects. So, in my reading, my understanding is the side effects weren't ever necessarily bad enough that someone would drop out of a trial, but they did describe things like nausea, headaches, difficulty with behaviors. So, sometimes it did make behaviors get worse. And so you can imagine anything that's biologically active that is affecting the brain can affect, the ability to pay attention. And I think there was even a concern for patients who have seizure disorders that it could also exacerbate seizures.
And what do we still need to research and learn about leucovorin before it's safe to prescribe it more widely?
Well, I think that it's important to understand for whom this medication would benefit, right? So I think that clinical trials that really try to pin down, appropriate dosing, the safety profile, the ideal candidate for whom leucovorin would have a measurable benefit are all the types of questions that we as prescribing physicians would want to know before we decide that a medication like leucovorin would be appropriate for a patient.
Well, that is great information. Do you have any last takeaways about leucovorin or autism that you want to leave our listeners with today?
Yeah, I mean, again, I think that neuroaffirming care is really important. And that's probably what I do with my patients on a daily basis is help their families and the world around them accept these children for who they are and support them as they need. And so I understand because in having cared for so many autistic children that there are clashes with the way that autistic children may see the world and the expectations that the world has for them. And that is what leads to these behavioral challenges. And so I find that a little bit of understanding goes a long way when it comes to managing these types of behavioral challenges and supporting parents in understanding their child really goes a long way as well. But, in this time where parents are being bombarded by so many social media messages and information from everyone around them, I can totally understand why it's confusing for parents. And so I think that part of our guidance really does emphasize the importance of shared decision making, right? I think it's important for the pediatrician to be a trusted source of information. I don't think that we necessarily have to be a gatekeeper, but I do think that parents have to be informed before they make a decision or really want to pursue leucovorin for their child. And so I will say that I have never prescribed it, but as more information has come to the forefront about leucovorin, I've been kind of surprised in the last couple of weeks that families are now admitting to me that their child has been taking leucovorin because they found a different physician to prescribe it, which is totally fine. And I think it's important that we don't make anyone feel guilty, make anyone feel bad. I think it's important to have the open lines of communication so that we understand why parents are making these types of decisions and to support them in it, but then also just make sure that they're aware of, potential side effects as well as the importance of letting physicians know so that we can make sure that there aren't drug interactions with other medications that they may be on, and then ultimately whether it's actually making a difference. So in cases where families have told me that their child has been on leucovorin, I've asked, did you notice a difference? And if they haven't, I say, well, maybe we don't need it then. But then I do have families who swear by it, that the leucovorin is what's managing their child's behavior. And I say, okay, that's fine, and let's just keep an eye on it, make sure that everything is still going well, and optimizing all the evidence-based supports that support autistic children.
Well, I think you just spoke so eloquently about the conversations that pediatricians really want to have with families. So, Dr. Alice Kuo, this has been so helpful. Thank you so much for joining us today.
Thank you for having me.
For more on leucovorin and its use as a therapy for autism, visit our website at aap.org/podcast.
Coming up, we'll discuss the 25th anniversary of PediaLink.
David, can you think back and tell me what it was like for you to study for the pediatric boards?
Oh, Joanna, I don't even have to think back that far since I took my pediatric hospital medicine boards just about 1 year ago. Honestly, I just took pre-test questions over and over and over until they all started to look the same.
I remember studying so hard for my initial pediatrics boards, and for me, it was always important to do the same as you, question after question, to stay engaged and learn from getting them wrong in practice. It was really my first time using AAP resources.
Oh, yeah, and without prep, I don't think I could have passed. I honestly don't remember what we did before we had PediaLink. 1998 is, a little fuzzy for me. I don't know, books maybe. But I want to be sure that we tell all the doctors thinking about studying, whether it's for the boards or for maintenance of certification or just to stay at the top of their game, that the AAP is there to support them.
So we have to talk about PediaLink then. It has grown so much and was an essential resource for me in studying for all my pediatric exams, my general pediatric boards, but also my neonatology ones too. So let's welcome to the show Dr. Scott Carney.
Dr. Carney is a pediatric hospitalist at Prisma Health in South Carolina. He's the program director for the Prisma Health and University of South Carolina School of Medicine Columbia Pediatric Residency Program and one of the authors on 25 years of PediaLink, transforming the landscape of pediatric education. Scott, welcome.
Hey guys, thank you guys so much for having me. Really excited to get to share this space with you and talk a little bit about PediaLink and what it is and where it has come over the past 25 years, because it's really changed a whole heck of a lot, and the future's pretty bright for the changes that are coming to it as well.
Scott, we are super excited to have you on, and this is a genuine question. How would people prepare to study and stay up to date on current information before PediaLink? Because I used it so much in my training.
Yeah, I think it was really a challenge for people to just assimilate information and really to even have questions that they were looking at that were considered almost like standard questions that they would have on the American Board of Pediatrics. So a lot of times it was word of mouth. A lot of times it was hearkening back to note-taking days, right? Sitting down with your Nelsons or different things and trying to grind through it and find the answers that you needed to your questions. And so what PediaLink really did back in those days was to take all that information, put it in one place for people, put it in a place where they know they could go and trust the information that was there, to really look through some questions that go through a really rigorous process in their development to reflect the knowledge that people needed to have to prepare for their boards. The value of the questions and the prep material back in the day when we were all still pulling up the prep books wasn't just in the questions. It was actually in the vignettes and in the write-ups afterwards. So you could learn just as much if you got the question right as if you got the question wrong.
I love that. And my math isn't the strongest, but I'm going to take a stab here that given that PediaLink is 25 years old, I suppose the resource debuted in 2000. What were initial versions of it like back then?
Yeah. So if we can all remember back to the days of the early internet, some of us that are listening to this might not have even been born yet when PediaLink debuted, but to the early stages of the internet, it looked very much like that. It was a real rudimentary system where you would kind of log in and it wasn't real user friendly, wasn't easy to navigate. But over the years, it's become a lot more iterative. It's become a lot easier to know where you're going and to connect resources together. And I think that's been one of the really cool things is that no longer is PediaLink just a resource for prep. It's also a place where people can go to learn about the Healthy People initiatives, to learn about Bright Futures, to do quality improvement through the eQuip courses. So really, it's meant to be an educational resource for everybody in every shape and form when it comes to pediatrics, which is a pretty cool thing.
You know, Scott, you were just starting to list all of the many resources for pediatricians that PediaLink has. And I think in the beginning, we were sort of focusing on questions for the boards, but you mentioned things like Bright Futures and other areas. Can you give us sort of a table of contents for exactly what's contained in PediaLink?
A lot of things that are there include some educational material for people, whether those are live courses or virtual courses, so people can tune in to take courses and learn things there. There's obviously the prep curriculum to help people in sort of board preparation. eQuip is our online platform for quality improvement and education there for practicing pediatricians. It also houses our data aggregator, the KITA platform. There's a growing area on PediaLink actually even dedicated to things like simulation and global health. So helping to educate pediatricians that are kind of moving into those areas. And then there's a whole section that's dedicated to program directors and trainees. The program directors utilize PediaLink quite often to help develop individualized learning plans for their residents. So a lot of us, I think, can remember the days of PediaLink and having to go onto it and set up your individualized learning plan every single year and really form a way of ongoing education for yourself and lifelong learning. And that was the beginning stages of that for, I think, so many pediatricians. And that's something that's continuing to grow and change over the past few years in PediaLink as well.
And as someone who's worked a lot in hospital quality improvement, I don't think I've made nearly enough use of PediaLink's QI resources. Can you tell me what I'm missing?
Yeah, I think a couple of things that you're probably missing. So part of the beauty of PediaLink is the connectivity and creating communities, to be honest with you. So the quality improvement section of PediaLink has the educational portion of it with the eQuip modules that are present, which create ready-made projects for people in quality improvement. But for individuals like yourself who are maybe looking for some quality improvement or looking for a group of people, a community of people that are doing quality improvement in your area, things like KITA allow for you to actually aggregate your data with other practitioners, do quality improvement together, and really make some impacts and changes. So a lot of those things have led to publications that we're all reading in pediatrics or hospital pediatrics. A lot of those things get their start through PediaLink and through some of the QI platforms that are housed underneath it.
Do you feel like there is one group of AAP members that gets the most from this resource? Like, is it more beneficial for trainees than, say, attendings?
Yeah, so I think traditionally that has definitely been the case, that PediaLink and particularly PrEP, which has kind of been the big shiny object that we've all thought about when it comes to PediaLink, has been utilized more by residents than anybody else. Program directors are probably a close second to residents, but those resources have always been, I think, a trusted source for individuals to know that they're getting a quality resource when it comes to their educational assessment and knowledge. But more and more what we're wanting to do is to really expand our reach and start to work more with medical students and faculty members and practicing pediatricians to really realize that PediaLink has a place for everybody and that it really is the online educational source for all practicing pediatricians and for those to come as well.
And speaking of being a place for everybody, I understand that PediaLink has resources that extend far beyond just those for doctors. Can you tell me what the offerings are for allied health professionals and families?
Yeah, so we're really starting to work more closely with our allied health professionals to make sure that people like school nurses have a trusted source in the world today where there's so much information out there and really not knowing what you can trust, what you can't trust. We want to make sure we're providing things to people that are interacting with families directly, like school nurses, allied health professionals, our advanced practitioners, and really creating sections for them in PediaLink as well. There's also a small growing section of PediaLink that is direct to consumer and direct to the families as well. So providing educational resources for daycares in particular and certified daycare centers to be able to educate families about well child care, healthy nutrition, eating habits, sleeping habits, those things that sometimes maybe the parents are a little too afraid to ask their pediatrician or their healthcare provider. But as a trusted source of information, we want to make sure we're getting that information out to people that are interacting and taking care of kids on a regular basis as well.
And in what ways is PediaLink thinking about adapting for the next 25 years?
I think we're trying our best, just like everybody else, to foresee the future a little bit and think about what the future might actually look like. So right now, what that means is making sure we're leveraging technology as best we can, right? We're in the throes of an AI world right now, and PediaLink is no different. And so part of what we're doing in the 25th anniversary is really thinking about the next 25 years to come and what that might look like for practitioners, how we can leverage technology to really get information to people readily and to be the kind of information that they need to use and they want to use, and not making it onerous on them to be able to try and go and find things instead. And so that's really what we're trying to do, is reimagine what a future practitioner might look like and really trying to tailor it to the individual. And I think that's kind of where medical education is really gone in the past few years and where we think it will continue to grow and go in the future years. And PediaLink is no different. So we want to make sure that we're thinking about individuals, we're thinking about technology, and we're thinking about what it means to be a pediatrician in 2050, just as much as we are in 2025.
Well, Scott, hearing all this, I am genuinely excited to get online and do some prep questions right after we get off of here. Do you have any last takeaways for our listeners before they log in and join me?
Well, I think the takeaways that I'd like for people to have is just that PediaLink is really about pediatricians, and it's about practicing pediatricians, and it's an amazing resource and tool that is here for all of the members of the AAP and even people who are not in the AAP yet. But that as a resource, it's there to help us improve kids' lives. And that's really what the AAP is all about, right? It's power through education. And that's why, the PediaLink slogan is where knowledge thrives. And that's what it's all about, is really taking things to the next level for every person. And without the amazing work of a whole bunch of AAP members, whether that's physician members or staff members, none of it would be possible. And so it is a platform that is created for pediatricians by pediatricians, and it's going to do some awesome things for people, not just over the next 25 years, but I think for the foreseeable future.
Well, it was so awesome to have you on, Dr. Scott Carney. Thank you so much for joining us today.
Awesome. Thanks, guys. I appreciate you.
To read 25 Years of PediaLink, Transforming the Landscape of Pediatric Education, visit our website at aap.org/podcast. At the end of every episode, we'd like to leave you with something positive or enlightening. We call this segment Say Ah. David, what's your Say Ah this week?
Well, I'm kind of on a visiting my adult children kick right now, and that's just so much fun. So I recently got to see my younger son, and then I went right around and saw my older son, who's living his best life as an actually employed college graduate in Boston, and he's got a real apartment and real clothes and a paycheck and everything, and it's just so mature. It was so much fun.
Well, luckily, I don't have to go far to see my kids day to day. So my say is something I've been talking about on the podcast a lot, which is Simon's allergy testing and the journey that we've had with that. So the journey ended with the food challenge test. And drum roll, please, David. He does not have anaphylaxis to peanuts. So we are super happy about that. He clearly has an oral allergy or aversion. Mm-hmm. So to get him to eat peanuts to make sure he did not have anaphylaxis was not a great say-ah moment for me. We landed on peanut M&Ms. And he had to eat an obscene number of peanut M&Ms to clear himself of his peanut allergy. But we did it. Which is just very exciting because now we just have a little bit less to worry about with the EpiPens and whatnot.
Well, you know, when you need the M&Ms, you need the M&Ms.
And now we can enjoy Thai food again, David.
I like that. Well, that's it for today's episode. If you like Pediatrics on Call, please subscribe on your favorite podcast app and help us spread the word. Follow us on YouTube, Facebook, and Instagram at Pediatrics on Call.
Pediatrics on Call is a production of the American Academy of Pediatrics. Our producers and editors are Ann Johnsos and Claire Keating. Our audio engineer is Doug Nagel. Joe Puskars is our associate producer, and Susan Martin is our executive producer. Our theme music was composed by Matthew Simonson. Join us next week when we'll look at recommendations for COVID-19 vaccines in infants, children, and adolescents.
We'll talk to one of the authors of a new policy statement, Dr. James Campbell. I'm Dr. David Hill.
And I'm Dr. Joanna Parga-Belinkie. Thanks for listening.